Good morning, and thank you very much for inviting me. It's my distinct pleasure to be here. I will begin by reading out a message from Dr. Oleg Chesnov, the Assistant Director General for WHO. You perhaps know Dr. Chesnov very well. He comes from Russian Federation and was supposed to be here, but because of other responsibilities, he was not able to make it here. Dr. Chesnov says, and I quote, "On behalf of WHO, I am pleased to congratulate the organizers of the Congress of Mental Health, meeting the needs of 21st century on 7th and 8th October 2016 in Moscow. Mental health is attracting increasing attention by policymakers in view of the importance of this area within health, as well as within the overall development of countries and communities. The inclusion of mental health and well-being in the United Nations Sustainable Development Goals is a testimony to all countries in the world recognizing the value of mental health. WHO member states adopted the Comprehensive Mental Health Action Plan in 2013 to define clear objectives, indicators, and targets for mental health and committed themselves to a set of actions to achieve the agreed targets. Individual conditions like depression, dementia, and autism have also been the focus of discussion at high-level policymakers. The Congress, being a multidisciplinary and multi-sectorial one, is an excellent opportunity to discuss and plan for mental health, attaining a high level of priority within the health and development agenda. A lot needs to be done, and the needs are urgent. I feel convinced that the Congress on Mental Health will result in not only better understanding of the issues, but also clear plans for action and a renewed commitment by all participants." Unquote. Honorable Ministers, the President and the office bearers of Union for Mental Health, dear delegates, international, but also from the Russian Federation, I'll spend the next 15 minutes in giving you some technical material on why mental health should be in the interest of all of us, and what WHO is doing about this for the next few years' time. I begin by pointing out the enormous burden of mental disorders, more than 10% by the calculations of the global burden of diseases, but in addition, there is the burden of substance use as a risk factor, the burden of suicide, which has been referred to already in the introductory comments, as well as behavioral risk factors for other diseases, which together with the 10% burden increases the value considerably. Mental disorders are responsible for 1/3 of all disabilities because of health condition, and depression is the largest contributor to this burden. In addition, I would like to point out that this burden starts at a very early age. In this chart, you see that the burden is highest in young adults, and it continues throughout the life course, and in fact, it increases around the end of the life course even more. So this burden is affecting the people who should be active and working and contributing to the economic and social values in the community. Unfortunately, they get affected by mental disorders and can contribute much less than what they should be doing. This slide is difficult to read, but I would just like to point out that the burden of mental illnesses and neurological illnesses is increasing, and in the coming years, it will be higher than what we have seen earlier compared to other diseases. And if you disaggregate this burden, the first chart shows you the burden because of death, where the mental disorders contribute relatively less. But as soon as you go to the other chart, because of disabilities, the burden is really very, very large. It is not true that mental disorders do not cause death. They cause death by suicide, but they also cause death because of many physical illnesses which people with mental disorders suffer from. So the numbers of death are still for the entire globe in tens of millions of people who die because of either direct or indirect causation by mental disorders. Even on economic terms, mental disorders are responsible for a large amount of cost to the society. It is not in millions of dollars, it's not in billions of dollars, as calculated by the World Economic Forum. It's in trillions of dollars, starting with a T, which is for any country, whether high income or low income, are excessive costs that societies cannot bear with. However, we treat people with mental disorders extremely badly. For common physical conditions, the treatment rates are much higher than for common mental disorders. The gap is really very, very large in almost all countries. And if you add the human rights abuses, then it becomes again a much larger economic, social, and in some ways a moral burden. It is not true that human rights abuses against people with mental disorders are limited to low-income countries. They are present in all countries, whether high, middle, or low-income countries. According to WHO, the services need to be organized in the most efficient manner, beginning at the bottom with self-care and informal community care, where a number of disciplines and number of community organizations need to be very active. They cost very little, but they should be available in large volumes, in large amounts, for everybody who needs it. And if you go above on this pyramid, there is the health services by general practitioners, doctors, nurses, social workers, psychologists, and then at the top there are specialist services. They are very expensive, but should be available in small amounts. Unfortunately, in many countries, this pyramid is lying upside down. There are few services, and most of them are managed by specialists. We need to change that. This is WHO's message for efficient mental health services. WHO's member states, 194 countries, including all the ministers of health from all countries, including from the Russian Federation, passed the WHO's Mental Health Action Plan in 2013. This action plan has a vision, a world in which mental health is valued, promoted, and protected. Mental disorders are prevented, and persons affected by these disorders are able to exercise the full range of human rights and to access high-quality, culturally appropriate health and social care in a timely way to promote recovery, all in order to attain the highest possible level of health and participate fully in society and at work, free from stigmatization and discrimination. It's a long vision, but each and every word is important. Note here that mental health promotion comes before treatment. The services should be culturally appropriate. The services should be for health and social care and to promote recovery, and also to remove stigmatization and discrimination. Each and every phrase in this vision is important, and all countries need to work towards realizing this vision in a time-limited manner. There are 4 objectives in the action plan: effective leadership and governance, mental health and social care services in community-based settings, and I must specify here that a number of countries have services in large, old-style mental hospitals. The countries have now committed themselves for community-based settings, and that is a vision that we need to realize in a very clear, time-based manner so that we can provide services within the community. The Vice Premier this morning has already talked about that. There is no reason for people to go to mental hospitals. Services should be there near where they live, and that's the vision every country should work towards. I'm very happy to note that the Russian Federation policy is working towards that. Third objective, to implement strategies for promotion and prevention. And lastly, to strengthen information systems, evidence, and research. There are 6 cross-cutting principles: universal health coverage, human rights, evidence-based practice, life course approach, multi-sectoral approach, which is very clear from this morning's participation in this Congress, and finally, empowerment of persons with mental disorders and psychosocial disabilities. We need to involve people who have problems because of mental health in their own services, in their own planning for what they should get. There are very clear targets in the action plan. 80% of countries should have developed or updated their policy or plans, and 50% of countries should have developed or updated their law for mental health. Service coverage for severe mental disorders should have increased by 20%. You might say 20% is a very modest target, but where we are in a few years' time, if we can achieve that, that will be a great success. And we are talking about countries which are at a very low level of services. Target for objective 3, there should be prevention and promotion programs, and the rate of suicide should be reduced by at least 10%. The Vice Premier already talked about suicide in Russian Federation, which is higher than the global average, but fortunately it's coming down, so we have hope that there will be, in the next 4 years, a global reduction by 10%, but I'm sure Russian Federation will perhaps make even faster progress to contribute to this global target. Lastly, there should be a set of mental health core indicators that need to be used for collecting information and reporting, because unless we can measure what we are doing, we will not make good progress. This is on one page, the entire action plan. We have some handouts which you are most welcome to take, and this is also available in Russian language. The role of WHO is to guide and support member states like the Russian Federation and all other countries, to offer technical assistance and to monitor global mental health situation that we do, including by WHO's Mental Health Atlas, which we publish every few years, which has data like this: where the world is on mental health, how far are we from the targets that we have defined for ourselves. And this is an important activity of WHO. By publishing Atlas, we put a mirror in front of all the countries. This is where you are compared to where you should be. So this is an important exercise for us, and we measure the progress over a period of time with the statistics like this, that although the burden is more than 10%, but it's only 1% of all human resources for health which are devoted to mental health. There is a large gap between how many people should be there in the health services caring for people with mental disorders and how few people there are in all countries. Fortunately, Russian Federation is not that bad. It has a very large number of psychiatrists, psychologists, social workers, and other people. But the point is to efficiently utilize their services to deliver community-based services, where in Russian Federation we have a lot of ground to cover. And similar other statistics, which I'm not going to spend too much time on that, but you're most welcome to look at our atlas, which is online, and gather more information about where countries are. I will end my presentation with just referring to the Sustainable Development Goals of the United Nations, where there are 17 goals. Third goal is on attaining healthy life for all ages, and within that, there is the goal of reducing premature mortality from non-communicable diseases through prevention and treatment, and to promote mental health and well-being. This is the first time the United Nations has agreed as a part of the Sustainable Development Goals inclusion of mental health and well-being. And we must make good use of this commitment by countries at the highest level. There is also a goal on strengthening prevention and treatment of substance abuse, including narcotic drug use and harmful use of alcohol, which again Russian Federation is very much aware about the kind of progress that we need to make in this area. Thank you very much for your attention.